I'd like to thank Kyle and Sang for putting this symposium together. It is quite a daunting task to be finishing off the lecture, but thank you to you all for sticking around, and hopefully I'll help you learn something. I have no disclosures. So maybe some of you are wondering why a venous thromboembolism lecture is tagged at the end of an IBD symposium, but I'll get to that in a little bit. But when I first constructed this presentation, I started out with this line: very few studies exclusively examine the risk of VTE in patients undergoing colorectal surgery. And it's good to find out that as I went through all the data, I actually am pleasantly proven wrong. But let me just start out from a historical perspective. Prior studies have demonstrated that the risk of DVT in colorectal cancer or colorectal surgery patients is elevated compared to our general surgery colleagues, as well as the risk of pulmonary embolism in comparison to the general population. This is a population-based study that came out of the UK, which examined inpatient surgery and examined the incidence of DVT, or actually venous thromboembolism risk, from the day of surgery on. And as you can see here, that the risk of venous thromboembolism extends to approximately 12 weeks, even after their inpatient surgery. And thus the concept of extended DVT prophylaxis was born in order to sort of counter that and to see what we could do to diminish this risk in these patients. Our latest practice parameters in regard to prevention of venous thromboembolism was published by the American Society of Colorectal Surgeons in 2006. And basically what they did was they stratified patients by their various risk factors and made their recommendations based on the culmination of these risk factors. However, there was no discussion regarding extended DVT prophylaxis use in colorectal surgery patients at all during the formation of these guidelines. One of the first papers to look at extended DVT prophylaxis within a general surgery population was published by Dr. Lawson in 1998, where they first examined 1 week of DVT prophylaxis versus 4-week DVT prophylaxis with low molecular weight heparin. And this is in a general surgery population here. This is a randomized controlled trial where they enrolled 176 patients, but only had 118 patients eligible for evaluation. And they examined the number of DVT events. And as you can see here, that the control population had a higher incidence of DVTs compared to the prolonged group, the patients who had 4 weeks of treatment of low molecular weight heparin, but this was not found to be statistically significant. And this is a table here from that study, which demonstrated that a majority of these patients underwent colorectal surgery.